He's 89 years old. He lived on his own with a little bit of help from the family until that time, and then since then, the last 5 months, he's been absolutely enmeshed in the system, and I've been there, and I've been in hospitals and long-term care places for about 5 hours a day, maybe a little less, maybe if it gets bad, a little longer on other days. A lot of you know what I'm talking about. You've either just gone through it or are going through it, or you know people who are going through it. Let me say in advance that I've watched really carefully in those 5 hours a day in these places for 5 months. I've seen a lot of stuff in a couple of hospitals and a couple of long-term care settings. And I come away very, very impressed with the people on the ground who are doing the work. The RNs, the LPNs, the care aides, the custodial staff, the dietitians, you know, the physios, if they provide them, right, the occupational therapists. I tell you, I am so impressed with the compassionate, caring approach that they take. I was very pleasantly surprised, okay? So what I also found is they are so stretched, and they simply don't have the resources to do what they know how to do. And I see them all the time, they're really frustrated because when you're in a caring situation and you can't give the care that you know you should be giving, you get all guilty and you get frustrated and anxious and all the rest of the stuff. But from the beginning, the bad experiences that I and some other people who have been in situations that I'm going to talk about a little bit, those are not due to wanton and negligent acts by healthcare professionals. They are due to bad management, bad policies, inadequate resources, and a dumb government. No, they're not even dumb. They're an uncaring government, right? So can we be clear on that? So when I tell you these things, it's a management and it's profit and it's a number of other things. My father's situation, he went into hospital on July 3rd after dehydration and a fall, and you know the story, right? It happens. He's 89, and it progressed to other difficulties in the hospital. They did really good work with him, and finally he was ready to go to a long-term care situation. Now, I'm the board chair of Public Interest Alberta, and I have a lot of friends, and so I call Sandra and I call all sorts of other people. I said, my dad's going to go into long-term care. I come from a family of assertive people. My sisters they're really strong people, right? And so there are a lot of advantages. We knew what we were getting into, and we just got completely rolled over. When they say, give us your 3 choices, so we're told, give us your top 3 choices. So we gave the top 3 choices, and then none of that mattered at all because, of course, it is the first available bed. So we also researched where not to go, right? And we found out there are places, not hard to find out, don't go there, don't go there, don't let your dad go there. And sure enough, when we were told, here, we have a bed for your father, and it's in this place, it was a private long-term care place that we had heard bad things about, and we had checked out our rights, and we had a couple of rights. And one of the rights, like you can't really turn it down, but you kind of can. You sort of can. So we had rehearsed it all. We went into the meeting, and the first thing they say is, well, you know, you have to accept this. There's no choice. And they would say, well, essentially we were told, you can turn it down if you say you can take him home. Well, we can't take him home because he was assessed for long-term care. But they always say, well, you're one of the alternatives to take him home. But you can't do that because he's been assessed as lead, so home care can't do it. So then we knew the second thing was coming. If you leave him in the hospital, you're going to be charged for as much as $1,500 a day. And we knew that was it. But we were so upset about sending him to this place that we thought, well, we talked about ourselves, we'll find the money. And we're going to keep him in the hospital for $1,500 a day and wait till another place. And they said, oh no, you don't understand. If you leave him in the hospital and pay us $1,500 a day, we take him off the placement list. So I said, this isn't a choice. This is coercive bullying, you know? So anyway, they put him in this place, and it was, they put him in this room with this other unfortunate fellow. It was this tiny little room. We thought, you got to make the best of it. He, in no time at all, he moved in on August 16th, and in no time at all, he had catheter issues, right? And he's old, and he has too big a prostate and all this sort of stuff that you don't even want to hear about. But there was a blockage, and he was sent to emergency, and they were told, you have to flush the catheter every 2 days. Like people who know nursing know, it's a simple procedure. You got to flush it, twice a day. You got to flush the catheter. And they said, and this is a private, for-profit, long-term care place, they said, we don't do that here. So, well, it's medically necessary. We don't do that here. So we went back, got another blockage within 2 days, was sent back to emergency again. They cleared the blockage, they sent it back and said, you got to flush this. Said, we don't do that here. And so he got another blockage, of course, within 2 days. And so he was in emergency 3 times within a week. And then they said to the hospital, don't send him back. We won't take him. They didn't tell us that he had lost his place in the institution. All we heard was, we got a phone call saying, your father, clean out your father's stuff by 5 o'clock on this particular day. We need the bed. That was the notification that we got. But meanwhile, his situation became entrenched, right? And all this had backed up. And so he got all sorts of difficulties. Went back to the hospital, acute care, $1,500 a day. Situation got worse because of the entrenchment. Oh, and by the way, every time it'd get blocked, then you'd get a urinary tract infection, of course, right? Because as soon as it's blocked, it's a petri dish for breeding microbes. And then the syndromes of, then as soon as you get a urinary infection, it makes you, as an older person, it just makes you crazy, right? And you do all sorts of stuff you wouldn't do. They fall, so he fell a few times and injured himself. Then he got pneumonia, right? All because people wouldn't flush a couple of times a day because they don't do that. Why? Because they only want the easy ones, right? So finally, we thought he was going to die from pneumonia, and I'm very skilled in caring people, got him through. And then we won the lottery. Because, oh, by the way, he was there for 2.5 weeks extra, ready to go, but no place would take him because they didn't want to take someone with any complications, right? So finally, a non-profit, a not-for-profit institution said, yeah, we'll flush that catheter. And so he's in this not-for-profit over the last few weeks, and it's great. It's great. Like, this is kind of a lucky, I don't want to say an ending, but at least, his situation. And he had aggressive family members there all the time, going to bat for him, knowing everybody, knowing what to tell him, what to watch for. And a whole lot of people in long-term care, like, I'm telling you, I'm the only person there visiting that particular day. Why? For all sorts of reasons, right? So that's kind of my quick take on it with what he's gone through. And he's a tough, resilient old guy who won't complain. The nurses tell him, you should be complaining more. You should be complaining more because if you don't tell us that you have pain, we can't help you. So will you complain more? And he says, a lot of seniors says, I'll do my best.